Hi there, my name is Abby Hutchison. I'm a nursing student at Mizzou in the RN to BSN program. I'm going to be doing my first part of the head to toe assessment. My patient here is Catherine. Catherine, can you tell me your name and your date of birth?
Catherine Justice, 8/19 of 84.
Okay. Can you tell me where we're at today?
We are in the doctor's office.
Okay. And you are here for?
Well checkup.
Okay. And do you know what day it is?
Yes, it's Monday.
Okay. What year?
2013.
Perfect. In this beginning part, I'm just overall just studying her cognitive function, make sure she's intact, she's oriented, ×4. Her speech is clear, and she is open. Just looking at her overall body language at this point, her emotion. Just also looking at her consciousness, she's alert, and by her responses and everything, she seems intelligent. So, then I'm going to go ahead and look at her overall face symmetry and note make sure there's no facial droop when she's sitting there. Looking at her neck at this point too, looking to make sure there's no lumps or excessive skin folds. I'm looking at her hair. Look at her hair and her skull. I'm going to go ahead and palpate, make sure there's no lumps or lesions. Also noting the texture of her hair. Make sure it's not super dry, not getting the nutrition or whatever. Make sure there's no dandruff or any parasites, anything crawling in her hair as well. I'm going to go ahead and look at her outer nose, assess her facial structure there. I look at her nose and make sure that the bridge of her nose is in line. Make sure there's no nasal flaring or no drainage, as well as drainage from any other areas on her eyes, ears, no abnormal drainage going on. I'm going to grab my pen light here and look inside her nose, noting the color and make sure there's no redness, any bleeding, anything like that. Make sure it's nice and moist, but not excessive. I'm going to go ahead and look at your mouth. If you'll open up your mouth, look at her pharyngeal cavity there, checking her tonsils as well. I'm going to have you stick your tongue out and say ah.
Okay.
Her mouth is clean, moist. Her oral hygiene as well. There's no thrush or anything growing there. Her tonsils are not swollen. There's no other swelling or lesions in her mouth, and it's nice, clean, and moist. I would also go on now and check out her neck, and I'm going to go ahead and feel her pulses, her carotid in her neck, palpating it, and then on the other side as well. And they both are both carotid pulses are strong, equal, and palpable. I'm going to go ahead and assess your thyroid gland. So I'm going to go behind you and just push to one side here. I'm going to have you lean forward. I'm going to push pressure on the one side and palpate with the left hand, noting there's no bulging or any nodules or anything like that. Now I'm going to have you turn your head again and lean forward, pushing pressure on the left side and palpating on the right. Again, same, no nodules or anything. I'm going to assess your lymph or your sinuses and your lymph. I'm going to start with your lymph nodes here. Light palpation. They're normally not palpable. I can't feel anything, but they're movable and no nodules, hard nodules or anything. I'm going to check your sinuses. I'm going to put pressure on there, making sure there's no pain or anything with that.
Okay. No, No pain.
No pain? Okay. You haven't had any headaches or anything?
No.
Okay. Just asking her questions like that to note the sinuses and make sure that those are, there's no pressure or swelling with those. Now I'm going to move on to the cranial nerves. First I'm going to start with olfactory. I'm going to have you hold down one nostril and breathe in. Make sure they're both patent. Great, so she can breathe through both sides of her nose. Then I'm going to grab some alcohol and put it on a swab and make sure she can smell it with each side and continue with the same thing. Yes? Great. Good job. She has her olfactory nerve is intact. She is able to smell. I'm going to move on to the optic nerve and test her confrontation, her peripheral visions with that. I'm going to have you cover one eye.
Okay.
And I'm going to, you tell me when you can see my fingers, okay?
Okay. Now.
Okay.
Now.
Okay.
Now. Now.
Okay. Perfect. Now I'm going to have you cover your other eye and do
Okay.
the same thing.
Now. 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 Now.
Okay, perfect. Her optic nerve is intact. She has peripheral vision. I'm next going to check her oculomotor, her trochlear, and her abducens nerves. And by doing that, I'm going to have her follow my finger and do the 6 fields vision test here. I'll have you follow my finger with your eyes. Great. So her eye movement, no nystagmus, no tremors with her eyes. She's able to follow that without any problems. Now I'm going to check her facial nerve. I'm going to have you make some expressions with your face. Have you raise your eyebrows. Great. Have you puff up your cheeks. Okay, smile real big. Okay, now squint your eyes as tight as you can. Okay, perfect. You can open your eyes. Her face is symmetrical. There's no drooping. She's able to perform these without any difficulty. I'm now going to check her acoustic. I'm going to do that by, I'm going to have you close your eyes and you're going to tell me which ear I'm.
Right.
Great. Left. Perfect. Just those light noise. The acoustic nerve is intact. We can tell that by she's able to hear those soft noises. You could also do like a whisper test. I am next going to check her glossopharyngeal, her vagus. I'm going to have you swallow.
Okay.
Okay. No difficulty swallowing. She swallows normal. If I didn't already check it with the test before when I was checking her pharynx, I'd go ahead and check her gag reflex, make sure it's present. Yeah. Make sure that you would use a tongue depressor and just make sure she does have a gag reflex. Wash your hands there. I'm next going to check the spinal accessory nerve here, and I'm going to have you turn your head and lift your shoulders, and I'll instruct you how to do that.
Okay.
I'm going to have you turn against my hand. Great. Again. Perfect. Now I'm going to have you raise your shoulders against resistance. Perfect. So her spinal accessory muscle is intact, and her nerves are intact with that. She has good movement of her head and shoulders. To check the hypoglossal, I'll have you repeat this phrase after me.
Okay.
Light, tight, dynamite.
Light, tight, and dynamite.
Perfect. She's able to enunciate the words, no slurring of the speech or anything, and she's able to enunciate those specific words that are able to test her hypoglossal. So, always perform good hand hygiene before and after, and